Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Pathogenesis of genitourinary tuberculosis. So first, in the pathogenesis of genitourinary tuberculosis, the pathogenesis mainly starts from the granuloma formation. If this is the kidney, in the renal pyramids, here in the renal pyramids, there you will see formation of granuloma will occur in the renal pyramids, and these granulomas will enlarge and they will form tubercular abscess. Okay, then these tubercular abscess will burst into the pelvic calyceal system, and when they burst into the pelvic calyceal system, this pus in the abscess will come or discharge in the urine, resulting in sterile pyuria. So sterile pyuria is seen in genitourinary tuberculosis. Then 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 there can be vesical irritability can be seen, because whenever there is sterile pyuria, the pus will enter the urinary bladder, resulting in irritability. So this vesical irritability is the earliest manifestation of genitourinary tuberculosis. Now,
thank you and thank you for watching.